Okay. So, good afternoon, everyone. Thank you so much for joining us for our Mayor's Wellness Campaign webinar, our mental health initiative, RFP technical assistance. Uh, it's a mouthful. My name is Katie Bisaha, and I am a community health and policy associate here at the New Jersey Healthcare Quality Institute. You often get me in your emails. Before we get started, I just wanted to go over a few housekeeping items. All the phone lines will be muted for the duration of the program, just to limit any background noise. As I said earlier, it will be recorded and posted on our website after the presentation, as well as emailed to those who registered. We do encourage you to ask questions by typing them into the chat box. You can just private message them to me, or you can put them in the general chat box as well. We will try to answer all questions as we receive them, but otherwise, I will get to your questions at the end of the presentation. I will also be answering all your great questions from registration throughout the presentation and then at the end of it. So thank you so much for submitting those. So, just to get started, as a reminder of who we are the New Jersey Healthcare Quality Institute, and we are the only independent, nonpartisan advocate for healthcare quality in New Jersey. So, our mission is to improve the safety, quality, and affordability of healthcare for everyone. And we bring together over 100 unique member organizations that all help us commit. All are committed to helping us achieve that goal. And at the Quality Institute, we have three main focus areas to improve all those areas. So it's policy, quality improvement, and community health. And the Mayor's Wellness Campaign is a part of our community health focus area. So if you're not familiar, the Mayor's Wellness Campaign is a statewide community health initiative in partnership with the New Jersey State League of Municipalities, and we provide evidence-based tools and resources to mayors and community leaders like yourself so that you can improve the health and wellness of your community. And this gives you the platform and the tools that you need to make your community a healthier place to live, work, age, and play. So there's over 400 plus communities that are a part of the Mayor's Wellness Campaign in New Jersey. And now we're just going to dive right into the application. So this RFP is in partnership with the New Jersey League of Municipalities and funded by the Walmart Foundation. The Quality Institute's Mayor's Wellness Campaign is focused on addressing community mental health needs. And these programs can address mental health, substance use, or prevention, intimate partner violence, and or stigma related to those areas. We also encourage you to use the Mayor's Wellness Campaign Mental Health Toolkit for program ideas. And the funding that is available is for 10,000, 15,000, or 25,000 and would be applied to by municipalities. And there will be up to 15 awards totaling in $127,500. And this is just the eligibility criteria. So you must be a New Jersey municipal government agency as the applying agency. You also should be part of the Mayor's Wellness Campaign. If you're unsure if your municipality is part of the Mayor's Wellness Campaign, or if you need some more guidance to sign up, you can email me at my email on the screen. And only one application per municipality will be accepted. And funding is restricted to municipalities. However, municipalities can co-apply with partners such as nonprofit organizations. And this is just our timeline for the grant. I highlighted one of our new reporting requirements, which is a schedule of activities, which is due at the end of the first quarter of the grant in January. This report will outline the awarded community's activities and interventions for the grant period, including the name, description, target audience, and what community partners are involved, and what your approximate plan dates are. This will help awarded communities to stay organized and provide opportunities for technical assistance from the Quality Institute as needed. And this is the scope of the work. So your programming should address, as stated earlier, mental health, substance use or prevention, intimate partner violence, and or stigma in your community around these topics. We're particularly interested in mental health initiatives that use the Mayor's Wellness Campaign and their team to plan, develop, and implement projects or programs. Focus on underserved and marginalized populations, provide community education about those topic areas, promote and increase access to healthy coping strategies in times of stress or crisis, foster a sense of belonging among members of the community or social connectedness, and utilize a holistic approach to promote health and well-being. And finally, increase access to affordable mental health services. Just as a side note, if you are utilizing the funding to make improvements to areas for that proposed programming, this can't be the only focus of the grant. So, as an example, let's say you wanted to build a Zen garden in your community. There should also be an inclusion of mental health focus activities for this new space in the grant. Um, we're going to now dive into the actual application and those questions. This first slide is pretty self-explanatory for the first few questions. So the name of your municipality, your mailing address, name of individual responsible for the proposed grant, as well as their email address and telephone number of that individual for the proposed grants reporting, and then what amount that you are requesting. And those amounts requested and on your budget should just be in the form of 10,000, 15,000, or 25,000. So they should match the funding options. Okay, now we're getting into the meat and potatoes of the application. So the first part is your project description. So that's where you're going to provide an overview of your project or programs. So strong applications will leave few to no questions about what the proposed project is. And this is really just intended to outline your entire project. The next question is program goals. This is where you would describe the goal of this program. So strong applications have a clearly stated goal that addresses mental health, substance use, intimate partner violence, and or stigma with evidence-based interventions. It should connect to your project description. So for example, if your project description is to educate, raise awareness, and provide resources to your community about mental health issues, it should then connect to the goal. And the goal could be to increase awareness and understanding of mental health issues within your community. Now, question 8 is your target population. So this is where you're going to describe the intended population for programming. Strong applications will clearly identify your intended population or populations. It is important to clearly identify that intended population and avoid generalizing the population you want to serve, such as everyone or all residents. And just remember that identifying a target population does not restrict those from outside of it to join it. It just creates a focus for your project to address the needs of that specific community, and that'll just make a really strong application. The next question is describing how your program will address the needs of underserved populations in your community. These strong applications will detail your inclusion of underserved populations, with strategies on how to include them is strongly recommended. So, for example, if your target population is LGBTQ plus youth, your strategy should include specific avenues for reaching this group, such as partnering with LGBTQ plus youth serving organizations or your school's GSA group. Okay. Now, question 10 is how you're going to describe your partners for the program and how you'll work with them. This can include municipal departments, school systems, health systems, providers, community-based organizations. These partners should include subject matter experts in the area that you choose to focus on. So if you attend intend to provide education to parents of LGBTQ plus youth about mental health, you would want to partner with a mental health expert to provide these workshops, or somebody that specializes specifically in working with LGBTQ plus youth. We highly encourage including stakeholders with expertise in mental health, and I highly encourage you to form the turned off. We highly encourage you to form these connections ahead of the grant period to mitigate any delays within the grant period. For example, if you were to include a local youth serving organization, but you don't have an established connection or at minimum have introduced yourselves to those partners, you may run into delays in starting your activities and projects. So if you're listing them as a partner, they should know that they're a partner. And Number 11 is program activities and projected timelines. So, with that, you're going to be describing the key activities that will be completed to achieve the goal of this program. So, you'll provide a general timeline for these activities. And this is a general timeline, but it should also align with your project description and goals. It should also be realistic, because this is a 1 year grant. A more formal timeline of these activities will be due at the end of the first quarter. And then the next question is about program evaluation. So there we'll want you to describe how you'll measure success for this program. And you would include specific evaluation processes and intended outcomes. These methods should be measurable and clearly identify the goals identified in question 7. So, for example, if my goal is to increase residents' awareness of mental health resources in my community, I should be asking my residents if the activities provided have done so. And attendance can be counted toward this measurement, but it shouldn't be the only measurement that you're using to evaluate your programs. And some examples of evaluation tools that can be used to measure success are pre and post surveys for events, feedback for planned events, number of resources distributed, feedback from partners and participants, hosting focus groups to gauge interest and provide feedback for what you have planned, number of health screenings conducted, follow-up assessments after a few months to measure the impact and outcomes measured. And we are here to also support you. So feel free to outline those things in your evaluation. And then if you need support to actually develop those, we can support you. And the last question is just new. So this is just confirming that you or somebody from your mayor's wellness campaign would be available to receive your award at the League of Municipalities on Tuesday, November 19th. And you would list who would be in attendance for this, as well as their contact information. Okay. Now let's hop into the budget. The budget should be realistic. You would utilize the Excel form that is on our website, and we encourage you to keep it simple. Make sure that your timeline and activities match, and then just make sure you're looking at those allowable costs. So if you plan to host 3 workshops, asking for a budget of $25,000 is unrealistic. The budget should clearly align with your project description, goals, and activities, and the cost should be directly related to the project and consistent with the grant terms. They must be incurred within the time frame specified by the grant. So if your application is requesting funding for giveaways or incentives, consider what the intention is behind them. Are they to reduce barriers for residents, such as providing transportation to and from activities? Or is it just to make them come, like a gift card or something? Just make sure the intention matches your activities. Okay. And these are just some important reminders. Applicants will respond to the questions and submit a PDF to my email address no later than 5 p.m. on Friday, September 13th. Late submissions will not be accepted. You will receive an email confirmation that your application was submitted, and applications should be submitted in single space, Times New Roman font, size 12, and should not exceed 4 pages. This is all outlined on the RFP as well. Applicants will also submit the budget form provided by the Quality Institute. Um, we also encourage you to answer all the questions. Applications received without all questions answered will not be reviewed. And I do see a question in the chat. If your project doesn't total the entire $10,000, can we still apply? I encourage you to build out your program to at least $10,000. You can still apply, but we encourage you to really stick within those 10, 15, or 25K parameters. Great question, June. Thank you so much. And then this is just kind of give you an idea of what a strong application will look like. So you'll ensure that the target population, activities timeline, and partners, evaluation, budget, and then will all reflect the project description and goals. And your project description and goals should address one or more of those targeted areas. So having a clear through line between each of the questions in the application creates a strong application. I know I use the word application a lot there, but I just wanted to give that some thought. And just to kind of give you some additional information about the programs that we funded last year. These are just a list of them, and you can see that a lot of common themes are mental health first aid training, specific populations that they're working with, stigma reduction campaigns, utilization of art to convey mental health messages, and resource connection and evidence-based programs. I do want to clarify that these are not the only things that we will fund. However, these applications clearly threaded the needle from their project description to their evaluation. Okay. I'm going to get to the questions at the end. These are also just a few other of those programs that we had funded last year. And then I received some great questions ahead of time, so I just wanted to answer those before I get into the chat questions. So can this grant be used to provide training for local emergency services in supporting individuals with mental health issues? Yes. Can this grant be used to address homelessness as a mental health issue? Absolutely. Can this grant be utilized to scale up a program that we already offer? Yes, and that's highly encouraged because it already shows that you are able to create this program and really you're just trying to make it more available to more residents. Another question we included or that was asked was, do programs selected need to be evidence-based? It is highly encouraged to ensure the efficacy of the programs. However, this funding can be used to pilot a program or project seeking to become evidence-based. Can this grant be used to support first responders, veterans, and military members to address mental health and stigma in those population groups? And yes, that would be your target population. You would just have to really identify how you're going to reach those groups. And then is this a reimbursable grant or are the funds provided upfront? The grant provides 90% of the funding upfront, and the last 10% will be received once the final report is received. Okay. And then just before we jump into more questions, I did also want to share with you there are other funding available throughout the state right now. So right now, the New Jersey Division of Aging Services has an RFP for age-friendly grant programs. So I encourage you to check out that information. I will be sending the slides and they're hyperlinked. So there's two types of grants for them, age-friendly community grant and an age-friendly project grant for 100,000. Their deadline is the day before ours. And we encourage you to take a look at the New Jersey Age-Friendly Blueprint. And that's a great resource for ideas and recommendations to address the needs of older adults in your community for our grant as well, specifically the socialization section. There's also through the anxiety and depression initiative, Get Out and Get Active grant RFP, and this supports projects that implement the use of physical activity to benefit mental health, and that's up to 10,000. And then just coming soon in 2025, the Department of State Office of Faith-Based Initiatives, their applications typically are due in February, and they do have a coming soon announcement for 2025 on the website. But there's multiple funding options for nonprofits or nonprofit faith and or community-based organizations that serve low-income residents, and you can partner with the municipalities for those grants. Okay. I am going to take a look at the chat and kind of answer the questions as I have seen them. Do, 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 do. Let's see. Let's scroll a little bit here. Can addiction treatment and rehabilitation? My headset usually doesn't have issues like this, but for whatever reason today, it keeps disconnecting. So, can addiction treatment and rehabilitation be included as a part of the programming? I believe so, yes. Anything related to substance use, misuse, or prevention. If you apply for 15 or 25,000, will a lesser amount be awarded or nothing will be awarded? There are potential, we could potentially fund the program at a lesser amount. We did have a few mixes and changes last year. When we do award, if we do award you a grant that is lower than what you had initially applied for, then we will reach out to you to ask if that would be okay, and for you to sign off on that. If you apply for 25,000, is there a chance you will be awarded a lesser amount? Yes. Um, John, when it comes to stigma, I am going to just refer the mental health toolkit um, that Annie had shared in the chat, and that'll give you a good idea of what we mean by stigma. I can open it and then just address it, but I'm going to work through these questions first. Are schools eligible for guest speaker programming? Yes. Thank you for asking. That can be your targeted audience, could be youth, and you can work in partnership with your school systems to create programs with them. Can this be used to provide mental health services? Yes. I'm going to just scroll back here. One of our programs that was funded in the previous year actually provided scholarships and funding for mental health services through BetterHelp. You can try other services as well. So thank you for asking. Interested in conducting a survey of our residents to learn more about their needs. Can we help with that? Absolutely. We can help you design a survey or provide you examples of other surveys that towns have done in regards to mental health. We can target it towards a specific group, whatever you may need a hand with. Feel free to reach out to me via email. And do you have any, do we have any other questions at this time? Let me just, let me grab that exact description of stigma in the meantime while I just give you all a little bit of time to brainstorm. So, in this case, as identified by our mental health toolkit, stigma is a set of negative and often unfair beliefs that a society or group of people have about something. And the stigma around mental health in the US is a serious issue that affects individuals with mental health challenges. I definitely encourage you to take a look at the Stigma Free campaign that is throughout New Jersey. I know that Bergen County has a wonderful toolkit that is linked in our handbook. Yes, I can absolutely add you, Michelle, to our mailing list. And I know that I added the question, I added that question to our um, webinar registration. So anybody that said yes to that will be added onto our mailing list. Yeah, absolutely. I definitely, the question is, can we partner with a hospital for mental health? We did a seminar on mental health in children and adults with St. Peter's. Yes, we highly encourage you to partner with your health systems. They're already doing a lot of this work. They have a lot of resources and subject matter experts that can help support and bolster your application. Gonna stop sharing my screen. Let's see. And let me make sure I'm not missing any. Oh, I see. I also have some questions in Q&A, so I'm going to take a look at those. Should resumes of key personnel be submitted with applications? No, you don't have to do that, but thank you for asking that question. Can it be used to provide mental health services? Yes, absolutely it can. As I stated earlier, we have had previous recipients use it for scholarships for mental health services. Oh, the PDF spacing requirements is just single space Times New Roman 12. However, those are listed specifically in the RFP as well. You can access the RFP on our website. Annie had linked it. I'm going to quickly link it again. It's directly on our Mayor's Wellness Campaign website. So even if you lose the link, you could just Google the New Jersey Healthcare Quality Institute Mayor's Wellness Campaign, and it's right front and center on there. And I can actually show that to you because we've got a little bit of time here. Great. Share my screen. Okay. So if you are on our website, you can just go to our work, Mayor's Wellness Campaign. And if you scroll down, the mental health initiative is outlined here. You can then click here for the application. This provides all of the information that we discussed during this webinar, as well as those requirements and application questions. You will also find the budget form here as well. And this button will turn to watch the recording this week. So the recording will also be linked on our website. Let's see. Okay. Um, Great. If there are no more questions, I wanted to just say thank you for joining us today. Feel free to reach out to me at my email address, and I will drop it in the chat for any questions that you may have regarding your application, or if you need any support in any way with your Mayor's Wellness campaign. Um, we are ending a little bit early, but that is a-okay. Feel free to bring your questions to my email. Um, and thank you. Um, and enjoy the other 30 minutes of your day. Happy to help. And thank you. Happy that this was helpful for you all. And thank you for your fantastic questions, both uh, via the registration as well as this webinar. Gonna stop recording at this time.